Heyer and Dr. Jessica Hopkins, Chief Health Protection and Emergency Preparedness Officer, Public Health Ontario. With that, I'll turn things over to Dr. Williams.
Good afternoon. Effective today, Ontario will be pausing the rollout and administration of the first or initial doses of AstraZeneca vaccine at this time. This decision was made out of an abundance of caution due to an observed increase in the rare blood clotting condition known as vaccine-induced immune thrombotic thrombocytopenia linked to AstraZeneca vaccine, or as we use VITT, VIT for short. As of May 8th, 651,012 doses of the AstraZeneca vaccine were administered with a rate of VITT of 0.9 per 100,000 doses administered. 202,873 doses of the Covishield vaccine were administered with a rate of VITT of 1 per 100,000 doses administered. However, over the last few days, there has been increased reports of VITT, in particular related to the AstraZeneca vaccine, with a rate of 1.7 per 100,000 doses administered. In collaboration with health experts at Public Health Ontario, the Science Advisory Table, and our federal, provincial, and territorial partners, we are reviewing the data to consider options for the use of the AstraZeneca vaccine for second doses and more broadly moving forward. Data from the UK points to a much reduced risk of VITT in second doses of the AstraZeneca vaccine. And we look forward to providing more guidance in advance of people's needing to receive their second dose of the AstraZeneca vaccine when their time for the second dose becomes at the correct moment. The decision to pause is also based on the increased and reliable supply of the Pfizer and the Moderna mRNA vaccines, and also our recent downward trend of cases. We're also seeing early promising results of administering 2 doses of different vaccines and have asked the National Advisory Committee on Immunization, or NACI as we talk about, NACI, to provide direction on the interchangeability of COVID-19 vaccines. Based on the much higher risks of COVID-19 infection recently observed in Ontario, including hospitalization, serious illness, and death, we maintain that those who received their first dose with the AstraZeneca vaccine did absolutely the right thing to prevent illness and to protect their families, loved ones, and communities. The health and safety of Ontarians remains our top priority. Ontarians are encouraged to get vaccinated as soon as they can and are eligible. The right thing to do to protect yourself and those around you is to get vaccinated with the vaccine you're eligible to receive. So those are my comments here, and I would be now open to take questions from the media that either myself or Dr. Heyer or Dr. Hopkins will answer. So I'm going to hand things back to Alex to moderate for questions from the media.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, doctors. Just to clarify, can you put in more layman's terms what this increased incidence means than those figures you were giving?
Okay. Well, thank you, Rob. And I'm going to hand it over to Jessica, Dr. Hopkins, to make some comments on those numbers in there. And I know we did quote the rate change from 0.9 per 100,000 to 1.7 per 100,000. But perhaps I think Dr. Hopkins can give you some more details of how that is put into other terms that would make it more understandable. Over to you, Dr. Hopkins.
Thanks so much, Dr. Williams, and thank you for the question. I think that first thing that's important to keep in mind is how the vaccine safety system is really working in Ontario and Canada, and that allowed us to identify this safety signal. So, there are healthcare providers, vaccine providers out there every day who are reporting into their local public health units, who then report up to Public Health Ontario, and we share this information with the Public Health Agency of Canada. And that's what's allowed us to be able to identify this safety signal. So what we've seen happening over time, and this is very consistent with what's been seen in other jurisdictions, is we've gone from estimates of risk about a month ago, and you would have seen those with the science table evidence review of about 1 in 125,000 to 1 in a million risk, to now what we are seeing in Ontario is what equates to a 1 in 60,000 risk. And so based on that increase, that's why we're here today talking about it, is that we've seen a safety signal and picked it up. And as Dr. Williams described, the context has changed. So happily, the numbers of COVID cases are going down in Ontario, and very consistent with the NACI statement, assessing the need based on the local context.
Follow-up?
Okay, thank you for that, Doctor. And just, Dr. Williams, you were talking about alternatives. So how long will this process take before people will know what to do about their second dose? Some of the people who got them in March are about 9 weeks out, so would be expecting some word fairly soon.
Yes, well, thank you for that, Rob. And that's very much on our mind. Those who went forward and got vaccinated, we said that was a good choice. They have their protection at this moment. We would like to complete that series in the timelines outlined, the 16 weeks originally. Sometimes it can be 12 weeks. We recommend with the AstraZeneca beyond the 12 weeks, preferably the 12-week period, 16-week period. We are looking at with our federal counterparts, and a number have undertaken studies at this time to look at the substitution of an mRNA vaccine as a second one to see what does that result in as far as the so-called vaccine efficacy. So we hope to have those answers in the next few weeks with that. So we're going to be advised by those studies and others internationally, so that when their time comes that they need to get the second dose, we will have that already ready and prepared for the public, so we can advise them accordingly and make sure that they get the full impact of vaccination and full immunization to the best levels we can attain for them in that. So stay tuned, and we hope to have that information as we partake in this on a pan-Canadian basis as well.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Dr. Williams, sort of following on Rob's point there, my understanding from the available research, or at least what's been publicly communicated, is that people who've already safely had the first AstraZeneca dose are at dramatically lower risks of any kind of complications from the second dose, if not zero risks. Should it not be a relatively straightforward decision that if we aren't using the AstraZeneca we have for first doses, then we could at least start moving people into second doses and thereby free up potentially Pfizer and Moderna doses that would otherwise go to their second doses?
Well, thank you, John. It's a very good question, and I agree. The data we have from the UK, especially, if you did not have a so-called VITT event following the first one, it is highly unlikely that you are very low risk of having the second one. That's the UK data. It's about 1 in a million. You can imagine how low risk that is. We are asking our tables, Public Health Ontario, as well as the science table here in our area, to review that data to make sure that we're satisfied. So that is one of the real options we're looking at, to make sure that if we are going to recommend people do their second dose with the AstraZeneca vaccine, they have all the information they need to make an informed consent on that matter. And I think you've raised a very good point. That's part of it. I also want to know that some people may say, well, is it okay to get an mRNA vaccine because we have a large volume coming, so we have that available also. So we think those options should be made available for the public in that. So thank you for that question, and that's part of the overall information material we hope to have ready for our individuals who went ahead and got the AstraZeneca with good advice and direction, and we want to make sure they be able to complete it in a way that they would feel satisfied with the best information, and we want to give that to you in the right time. So we're pushing on that right now.
And John, if I may, it's Dirk Heyer. Thanks for the question. The other things that need to be thought about is supply and the availability and the potential expiry of additional of the vaccine that may be available to us right now. right now, the dose interval is 16 weeks. So from March, 16 weeks from March is the first planned vaccine second dose in AstraZeneca, and then 12 weeks if there's a specific dose interval exception. So there is some time that we're carefully thinking about, and there's other factors included that I just wanted to mention, thinking about the new supply that's coming, as well as the expiry date of the current supply that we have.
Follow-up?
In terms of supply, how much of the supply that Ontario has on hand is currently AstraZeneca, and how much, I think last time we got a briefing, it wasn't clear how much more we were getting in the near future. Do we have eyes on when our next shipment is arriving? Yeah, so what do we have on hand and what's coming?
Dr. Heyer?
So we don't know when any additional AstraZeneca vaccine will be coming. We have not had confirmation of that. So we do not have a direct view into it. And we have approximately 50,000 doses of AstraZeneca, approximately, right now.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi, thanks. Yeah, I wanted to go back to that 1 in 60,000 figure, and maybe any one of you could try and contextualize that for us in terms of the thinking about risk from the blood clot thing versus risk from COVID. How does the risk sort of change? Can you give us some context around that number?
Okay, so I'll be asking Dr. Hopkins to answer that one again, but in more detail, because the points that were noted is two things. One, our new information on the risk in Ontario we're seeing with the AstraZeneca at this time, as well as our dropping rates of COVID from where a few weeks ago we were about 4,000 per 400,000 per day. We are now just above 2,000. So things have changed in both ones. So over to you, Dr. Hopkins.
Thank you so much for the question. So I think that this is really looking at what the risk of COVID is versus what the risk of an adverse event such as VIT is. So when we look at VIT, there's a spectrum of illness that can happen from people who are mildly symptomatic to people who can become severely ill with the disease. When you look at the risk of COVID disease, it's very much based on your individual situation. So the community that you live in and how high the risk is, whether or not you are an essential worker versus if you are able to work from home, if you are also vaccinated. And so it's all of these factors that go into looking at individual level risk. When you look at risk on a population level, what we're really looking at is, overall, does this safety signal give us enough concern that we would preferentially choose other products at this point in time? And given that we're seeing the overall case numbers of COVID going down and an increase in the safety signal at a population level, it makes sense to pause AstraZeneca, because the risk of severe outcomes with VIT shouldn't be underestimated. At the individual level, and I think that's what Dr. Williams was talking about a little bit before with the second dose, there are individual decisions that can be made as well, and those are much more nuanced. They depend on, your own health, your own risk factors, and all of those other things. So when you look at it on a large scale, our risk of a side effect from the VIT, it has gone from 1 in 100,000 to 1 in 60,000, and that's a significant safety signal that we don't want to ignore.
Follow up?
And to follow up on that, are those numbers then different? We're seeing more risk, more of these blood clots here than in the UK, where they used a lot of AstraZeneca, and I assume we were watching their numbers to compare. How do we compare? Are we worse than the outcomes in the UK?
No, so we've looked at our numbers in comparison to other provinces, in comparison to other countries, and they're all quite consistent. And I think what you've seen happening is, because it takes time for someone between the time of being vaccinated to the time of developing this side effect, and this is, like, to put it in perspective, it is a rare side effect. It takes many doses before you see it. And so early on, the rates that would be given, between 125,000 and 1 in a million is a huge range of risk. And what you've seen happen is that range is getting narrower as we've had more doses of vaccine given, and we've been able to monitor people over a longer period of time. So the numbers that we're seeing in Ontario are very consistent with what's being seen in other countries using these products.
And just to jump in and build off what Dr. Hopkins said, it's Dirk Heyer. I think the other thing that she's mentioned and clearly stated is that the adverse effect that occurs is a serious adverse effect, and so not only is it so lots of people get the side effect of a sore arm, some fever, and other things that occur with it. This is a serious side effect that could lead to serious health implications and potentially to people passing. And so there's many factors, but this is also a very important factor to think about.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Oh, hi, everyone. I just wanted to ask about the incidents that we've seen across Canada for these blood clots and across Ontario. I'm wondering if you have any updated statistics on that, as I say, in Canada and in Ontario.
Okay, so we monitor, and on our federal, provincial, territorial meetings, we compare our data and information on that. All of us in the different settings, and of course we report into Health Canada with the safety alerts that Dr. Hopkins has talked about. That's part of our so-called adverse event reporting system, and they are collating those. We have notified the federal government counterparts of our decision, as well as some other provinces have done already today. And we compare those, and we make sure there's a similar definition, which we did set upon, the criteria for diagnosis and assessment on that, so that we can go through all this in a very precise way with data collection information. So our national group is collecting the Canadian data and the national data there. We were running on about 1 per 100,000, but we had reviewed some data at least lately, and there was some concerns that it might be actually going below that to down to the level that Dr. Hopkins talked about, heading at some other areas on the national one. Of course, our larger provinces will have the database or the numbers that were needed when you're dealing with a rare event such as VITT to make it more apparent. So they look to provinces like Ontario, Quebec, Alberta, and British Columbia to see, because we're given a much larger volume of the vaccine, to see if there's any safety signals, as Dr. Hopkins was alluding to alert to that. So we have those comparison numbers, but they are changing as ours are when we're looking at our cases that are accruing through suspected cases. Then we go through a case review, and they moved up to probable or confirmed cases. So we're all dynamically involved in this. I'm not sure I have the current numbers that are for today for each of the provinces and territories, and the national summation of those at this moment, unless Dr. Hopkins has those readily available. I'm not sure she has them, but I'll ask her if she does.
So at the national level, it's approximately 1 in 55,000, and in Ontario, we're reporting 1 in 60,000.
Follow-up?
Sorry, folks. Maybe I didn't express that very clearly. I'm trying to understand how many instances we have seen across Canada and in Ontario of these specific blood clots, not the rates, but the number of incidents we have seen in, both across the country and in the province.
Maybe Dr. Hopkins, you can say how many we've had in the province. That's what we're talking about today, of those events related to AstraZeneca vaccines.
Yeah, so as of May 8th is our last reporting date. There's a reporting lag built in to the system. In Ontario, we have 8 cases of VIT. I do not have the national number for you at this point in time.
Next question.
Your next question comes from Ryan Timilty with National Post. Please go ahead.
Yeah, I'm wondering if taking AstraZeneca, I guess, out of your arsenal in any way impacts sort of your timelines for the vaccine rollout, or with so few left comparatively, will you still be able to get a first dose to most Ontarians by the end of June?
I'll start and I'll hand over to Dr. Heyer. With only of our ones we're receiving this week and next week, especially when we're getting a large volume of Pfizer and Moderna vaccine coming in, the AstraZeneca, we were not seeing anything on the horizon coming, and the remaining 50,000 doses, we were pretty well going to exhaust that fairly soon. So we were mostly dependent on to get that 65%, 70% on the pretense of having large volumes of Pfizer and Moderna coming in. But perhaps, Dr. Heyer, you want to elaborate on that.
Yeah, thank you for that question. Obviously, any vaccine that we have available to us to provide to the population of Ontario is something that we want to utilize. Having said that, we did not calculate our estimations of tracking to 65% of the population above age 18 receiving their first dose of vaccine by the end of May. We did not include AstraZeneca in those calculations. So we are confident with the tracking, despite this decision that we're making today, that we will be continuing to track for achieving at least 65% by the end of May.
Follow-up?
Yeah, and just on a partially related thing, the Prime Minister today talked about having most Canadians having one dose by summer, and that opening up the possibility of easing restrictions as long as cases fall as well. I'm wondering if the Ontario government is planning to offer guidance to people about what they can do with one dose and how they can, how they can get back to normal, I guess.
Well, that's a really important question. We're looking at that through many tables, not only with our public health measures table, information from consultation with Public Health Ontario, as well as our science table, and at the federal, provincial, territorial, the so-called Special Advisory Committee, that we're comparing data and information across the province of how we might incorporate that and the amount of protection we're getting. So now we're above 40%, heading to 50%. We now have enough population numbers. We're trying to see how does that impact population-wide levels of people's, their protection against severe consequences, mild consequences, and transmission. All these are important ones that would allow us to give some quality affirmation of if we can relax some measures in there, combined with some various settings in various places. So it's one we're really working at right now, and we hope to have some updates and reports to the public as well as to decision makers here in Ontario as we progress through this. And with the very good data we're receiving now with our numbers coming down, we're moving into a much more amenable area where we can incorporate the vaccine coverage combined with our ICU levels, combined with our case numbers and testing positivity, a number of factors in there. So you raise a very good point, and we're going to be using that and incorporating that information into advice and directions in the very near future.
Next question.
Question comes from Colin D'Mello with CTV News. Please go ahead.
Hi, Dr. Williams. A lot of people who have already received the AstraZeneca vaccine might be understandably upset by this news. I'm wondering what you have to say to, the 850,000 people or so who have already received their first dose. What should they be looking out for? Should they be concerned about their personal health? What would you say to them?
I think it's a good point, Colin. We're trying to make sure that what we're saying here, and as Dr. Hopkins has alluded to, we're not saying this on the basis that all of a sudden it's gone really extensively in a different light. We've seen the safety alerts, as Dr. Hopkins is saying, and that part of our role with our vaccine safety program, with our adverse event reporting systems and the dynamics that go on there, we're looking for every possibility, every inch of issues that are happening, and then we're moving on an abundance of caution to say, let's pause and assess this carefully. It's not that the risk of these individuals has gone up extensively at this time, but as Dr. Hires alluded to, because of sometimes it is severe, we want to be cautious and say, let's pause this at this time when we look at the data and information. I would say that those who have received it, and we've been looking at that from the federal definition, especially the first 28 days, as we've noted in some of the studies of the UK, those who don't have a problem with the first time around, even with getting a second dose, their data indicates there's very low risk of a second dose. At the same time, we need to make sure our data is current, up to date, And if we're going to be asking people to participate in a second dose on that one, it's with information that they can make the decision, including with their caregiver who may want to recommend that. So I would say your issues that when you decided to take the first time, when there was back in 1 in 100,000, 1 in 150,000, that has not changed dramatically. It is up somewhat. That makes us with a safety signal, as Dr. Hopkins used the term, that we want to move on that. And with an abundance of caution, we're asking to pause our caregivers in giving the AstraZeneca vaccine until we compare our data and information with other sectors. So we want to make sure we're being careful, but at the same time, we know that we have those who have made a decision before to get it. It was a good decision, and they will be looking forward to getting their second dose when we have all that information put together for them.
This vaccine provides significant protection from serious illness, hospitalization, and death, and has provided that protection to hundreds of thousands of people in Ontario, with unfortunately a small number of adverse effects. What was done, so each of those recipients should have been provided information about the things to watch for. This is an adverse effect that was known now for a number of weeks, and people who are receiving the vaccine were notified of that. Care providers across Ontario were provided information about what to watch for. If people attended to them as patients with certain medical complaints, and there is a treatment that's available for the adverse effect that can occur. So hundreds of thousands of people did receive protection that led to hopefully reduction in any potential illness in themselves, but also reducing transmission and the burden of illness across Ontario.
Follow-up?
Okay, and so over the next few days and weeks, I would assume you, Dr. Heyer, you, Dr. Williams, I mean, you know, your family members are going to come up to you and say, what do you think? Should I get the second dose of the AstraZeneca vaccine, or should I wait for the Pfizer vaccine or the Moderna vaccine? You know, I assume a lot of healthcare providers in this province, their family members and friends are going to be asking them the same question. What would your advice be to a friend or a family member who asks you, should I get the second dose of AstraZeneca, or should I just wait for Pfizer and Moderna instead?
Well, I know Dr. Howe weigh in with his comment. I would say it's a combination of what's supplied and what's available. We only have 50,000, so that's a lot of second dose. So one of our challenges is how to get enough vaccine to get the second dose, and we want it as soon as we can. And we're hoping to be able to move on that a bit more rapidly with our supply being very robust with the mRNA vaccines. I would think that I would want to have the data so I can say to them clearly, affirm, if you didn't have it the first time, the risk is terribly, terribly low of any problem on the second one, and you can go ahead and get it. I want to make sure that our advisors as PHO, Public Health Ontario, or the Science Table, or our federal counterparts say, we still stand by that data that's still very strong and still very firm. At the second time, we want to be able to say, if you get an mRNA, does that mean your vaccine effectiveness of the two doses together, is it equal and compatible with getting the two doses of the other one? I want to make sure I can affirm that. I think intuitively it makes sense to me, it could be, but I want to make sure our people doing the studies can affirm that for me before I say, go for an mRNA as well if you want. The other challenge is say, well, we're trying to get some other AstraZeneca, but we haven't got any, so you may have to wait a long time to get the second dose. And if it's okay to get the mRNA, then I would say book and sign up for it as soon as you can. So there's a combination of three things there that I'm going to be able to give them good advice on when we fulfill that. So I don't know if Dr. Heyer has any other comments to make of that.
Yeah, thanks for the question, Colin. It's a tremendously poignant question for the moment. And what I would say right now is we're going to answer those questions for you to the best of our ability. We need more information, and Dr. Williams has outlined the pieces of information that we need. Once we have those pieces of information, I'll feel quite confident to provide that advice to my family, my friends, my colleagues who I know have received AstraZeneca, and we are working together to give the best answers to those questions. So unfortunately, don't have it today, but we have all of the avenues to get that information, again, within the supply that may or may not be coming, and again, not having that confirmation. So there's a number of factors, but we are working within a time frame that we know still fits to the time for second doses.
Next question.
Question question comes from Cassandra DeBeal with Global News. Please go ahead.
Hi there. So many people who've actually received their first dose of the AstraZeneca vaccine haven't received any dates for second doses with their pharmacies. So how can those who received their first dose plan to book a second appointment? And what will this potential mixing of vaccinations, so Pfizer and Moderna, mean for any second vaccination timeline?
So I'll jump into that first, Dr.
Go ahead,
Williams.
Dr. Heyer.
So absolutely, we're well aware of that, and we are working, again, it's another factor within the time and the planning for the second doses of AstraZeneca. This is one of the things that fits within that planning, as to we have the ability through the COVAX system, which is the central IT database that we have in Ontario that tracks all of the people that have received a vaccine, and it's tracks by the type and the date. So we're able to know, and then to provide the opportunity for second appointment bookings through that. The pharmacy is also aware AstraZeneca, and the primary care professionals where the AstraZeneca was provided, they also know who attended. And so there's the ability to reach out. Once we have all of those other factors that Mr. DeMello asked us about in place, that's how we're going to plan. And we are getting increasing amounts of Pfizer and likely more Moderna, and those are all being factored in. The second doses, as well as the outstanding first doses within the province, those are all being factored into our planning over the next number of weeks.
Follow up?
So I'm just wondering, is there any kind of like rough date or timeline for those who are going to be who've already received their first dose of the AstraZeneca? Because I know there's a lot of kind of confusion going on amongst those who've received it. So any kind of date or timeline that you're kind of aiming for this to happen?
Sorry, go ahead, David.
No, you've already outlined these before, but go ahead. It'd be good if you repeated some of those.
Yeah, I don't have a specific date that we're going to do that, but it is something within the other considerations around the second dose of AstraZeneca. That is one of the key considerations that we are going to answer. The first doses of AstraZeneca began in March, and so 16 weeks you can calculate from March, the period of time, so that we are working to have that answer and to have the second dose booking arrangements obviously in suitable time.
Last question.
Your final question comes from Elizabeth Payne with Ottawa Citizen. Please go ahead.
Hi, thanks for taking my question. In Ottawa, there was a pop-up outdoor vaccine clinic just over the weekend in which more than 800 people were vaccinated with AstraZeneca. What do you tell those people now who are sitting there with this vaccine, and about what to watch for? About how they should feel about the messaging around this?
So I would start by saying to them that was good that they did go out to the clinic and get vaccinated with the rates that they're having, and while it's improving in Ottawa, it's important that they get protected, and especially in area of high-risk neighborhoods where pop-ups were put forward and launched. So that protection will give them good coverage, as Dr. Heyer already alluded to, against any severe consequences and hospitalization while they wait for the second dose. The other thing I would say to them is that that's why we're making the announcement today, is that we're doing a safety signal, not because what they got yesterday was totally wrong or was a high risk. We're doing it with an abundance of caution to say, let's look at it and be sure, because the difference in the risk has not changed substantially, but because we've seen it shift and move, we want, before it gets to anything more substantial, we want to pause and look at it and see what we need to do with that on a go-forward basis. So we have gone out and we have educated our healthcare providers, so that back about 2 months ago, they probably would have said, well, they didn't even hear the term VITT, but we have been carrying out a lot of education through our science table and other ones of our physicians who know about it in the rare time it might occur. And as Dr. Hires alluded to, there are treatments available for it, and we made those available, diagnostic methods and decision trees. So our healthcare community is much more tuned into that issue and made aware, if in the rare event it did occur. But even with those 800, the chance to find one among the 800 is going to be highly unlikely. But at the same time, we're much better prepared to deal with any issues that may arise on that much sooner, much quicker, than rather than our healthcare providers who are not aware of the problem and issue in the rare event that it might occur. And so I think I would reassure them that one, the vaccine they receive will give them protection, especially as the weeks go by. It continues to grow on that and maximize out at 12 weeks post-vaccination in there. So I think I would say it was a good choice to do. It was in the evidence of that related to COVID. It was a very safe one to do, but we want to make sure we're aware of any other changing issues in there and to take those safety points that Dr. Hopkins alluded to, and to make sure we check it out with anything further at this time. And that's why we're announcing this today.
Follow up, and this is the last question.
Thank you. And can I just ask for clarity on one issue? I know you said that the information you're waiting for includes how many doses you have, whether you can mix and match. But did you also say you're waiting for more information on whether it indeed is safer to get a second dose of AstraZeneca? And can you sort of clarify for me a bit?
Yeah, I can ask Dr. Hopkins to comment on that also. I was talking to the science table and saying this is information that would be very helpful to me. If you could review that to see what's the quality of that data, how does it apply in the Ontario Canadian setting? And so if we were going to do that on a go-forward basis, in a sense, we're talking about informed consent, and so that people understand that, so we can make sure our data is current, up to date, and robust, and in the Ontario Canadian setting. I don't know if Dr. Hopkins, you have any further comments to make in that regard.
Thanks, Dr. Williams. So when we look at data, particularly coming out of the United Kingdom, the estimate right now is about 1 in a million for VIT following the second dose of the AstraZeneca vaccine. And I think one of the things that we need to wait for right now is further information coming out from other jurisdictions as they're giving their second doses. And then for people who've received the second dose, you can see VIT between 4 and 28 days after receiving the dose. So it does take some time before you see enough cases to pick up a safety signal. I think that, one of the things that I don't want to happen is for people to misinterpret this. This is still a very rare side effect. 1 in 55,000 is rare. The reason that we're talking about it is because it was 1 in 100,000 before. And so it's still rare. And this is really out of an abundance of precaution. And that's why we have a vaccine safety surveillance system, is to identify these early signals that relate to safety and take action on them. So Public Health Ontario will continue to gather information along with the science table and share those with Dr. Williams and Dr. Heyer as more information, especially from international jurisdictions, becomes available.
That's it. The safety of our Ontarians, our public, is foremost on our mind. We want to make sure we're over cautious on that, and that's what we're doing right now.
Thank you, everyone.